Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues. Today on the program, our focus is on a health issue that concerns everybody, ulcer. We have different types and our guest is on standby to tell us how to prevent this health condition and also how to manage it. Stay tuned. The conversation begins after this break.
What if we could design an economy that would prioritize the health of all people and the planet we live on? Where a successful economy is measured based on every person's contributions to society, and health is seen not as an additional cost or potential budget cut, but as a necessary investment for our future. A world in which health innovations are shared for the common good so that everyone can access the healthcare they need wherever they live in the world. And where governments have the capacity and resources to drive these changes. This is the vision of the W.H.O. Council on the Economics of Health for All. The Council makes 13 bold recommendations informed by evidence and case studies from around the world. These recommendations should serve as a compass to guide us all towards a world in which people, planet, and the economy are aligned. Because the question is not why should we, but what's holding us back.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Wina Olatemiju, and she is going to tell us what exactly is ulcer. Dr. Olatemiju is a general health care practitioner and she is also an author of a best-selling book on health issues. Good evening, Dr. Olatemiju, and thanks for joining us.
Thank you so much. Welcome to the program.
All right, Dr. Olatemiju, tell us what exactly is ulcer. We hear a lot of people say, I have ulcer or I have been diagnosed. Let us know what exactly is this health condition.
Yeah, ulcer is a broad topic. It's an open sore in any part of the body, but definitively it is an open sore on the skin or mucosa membrane created by erosion or breakdown of the tissues. Ulcer can be formed, remember, can be formed in different parts of the body. But the only thing is they have some things in common. The most common type of ulcer is peptic ulcer. And this is associated with the gastric enterology, it's like the digestive system. That is why we call it GI tract. Peptic ulcer. It started from the stomach, then to the upper part of the small intestine, which is the duodenal. Gastric ulcer is common among people of different age, race, and culture.
Okay, Dr. Olatemiju, before we look at the types of ulcer, tell us what causes ulcer? What causes it?
Thank you. Different things causes different ulcer. They have different causes. Like I told you that it's a broad topic, and if a breakdown is an open sore on the skin or on the mucosa membrane due to erosion or breakdown of tissue. I also repeat that it can be formed in any part of the body. It can be formed in the leg. That's one. This diabetic foot is an ulcer. It's a wound, but it's formed in a particular place. And the area that is formed defines the name.
Oh, okay.
Yes. So when it is found in the in the digestive system. That's why we call it peptic ulcer, gastric ulcer. Gastric, that big gastrum is the stomach.
Okay.
So that's why they call it peptic ulcer. So when it is found in the leg, it can be leg ulcer. In the venous part, it's called venous ulcer. When it's found in the oral part, it's called oral ulcer. And different parts of the body, ulcer can form there.
Okay.
So what causes ulcer in these different areas of the body differs. So when we talk about, for instance now, if you say that this is the most common and most, widely known is this peptic ulcer to people. People complain of, I have ulcer. But they don't know exactly what causes the ulcer, especially when it comes to the digestive tract. Peptic ulcer, which is actually, like I defined, is from the digestive tract, stomach, gastric, and then duodenal ulcer, which is the upper part of the small intestine. Now, it can be caused by erosion of mucosal membrane. And there's one peculiarity about gastric ulcer. The gastrum has this protective nature, acidic medium. And this acidic medium, hydrochloric acid, is there to protect the environment against bacteria. It's also there to help form some enzymes to digest our food. The gastrum, remember, in the stomach is just the medical term that just gastrum. So when this ulcer wants to start, it can be that erosion of that, excessive erosion of that acid in the stomach. The stomach always has this acid as a protective measure. And is there to help and also to produce necessary things to digest our food. 4 hours, our intake, our food stays in the stomach before they get digested, they pass to the next level. So sometimes when this ulcer starts, excessive erosion of those tissues, because an open sore in our stomach, especially the upper part. So when it happens like that, we start having pain. These are the common features of all ulcers, associated pain. Whether it's leg ulcer, venous ulcer, gastric ulcer, or oral ulcer, they all associate with pain. They also associate with inflammation, they have swelling, discomfort. They can be infected with other bacteria, and so forth. These are common things, common features of ulcer.
Okay.
Now let me come back to this.
Okay, Dr. Olatemiju. Does this condition exist as a result of a pre-existing condition or a pre-existing health challenge? Does it just happen?
Yeah, in gastric ulcer, it can happen without any pre-existing. The common one is the one that's caused by H. pylori, Helicobacter pylori, the bacterium that is associated with gastric ulcer. That one, you don't need to have any pre-existing illness. The association with this bacterium with gastric ulcer is the leading cause of gastric ulcer. And this bacterium, now being in the system, gets himself established and cause all this pain, discomfort, and indigestion and everything, which is associated with ulcer. The one that is associated with pre-existing illness, chronic illness, they are what is called the non-peptic ulcer, and that is best sore, pressure ulcer. This one is associated with people that have been ill for some time and they cannot carry themselves. Pressure ulcer or bed ulcer is because they are lying down on the same spot for a long time. The skin, like I told you, the erosion can form. The skin of that, like buttock or the back, can get peeled. And because the person cannot carry himself, it becomes a big wound and it's called ulcer, pressure sore.
Okay.
So these are the one that's associated with chronic illnesses.
Okay. Apart from the pain and inflammation you mentioned, are there other symptoms, other warning signs that people can watch out for?
For peptic ulcer, there's other warning signs, like apart from pain, discomfort, we have this poor digestion, you can have some nausea and vomiting, and the person can also have loss of weight, loss of appetite, because there's also a reduced immune system, because the person cannot eat, even if he's trying to have a controlled portion of food, try to eat small bit by bit to help, but the system is not taking it, and the digestive system has issue, and the issue is this ulcer. It could be distressing, and like I said, these features is common with every other. It can be infected, and that is superimposed infection on this existing wound or sore in that skin or on that mucosal membrane.
All right, Dr. Olasumbo, tell us, most times we hear people say this person has been diagnosed of ulcer because as a result of the fact that the person does not eat. Is this true?
Stress ulcer is one type of ulcer that can pop up because of someone not actually taking good diet. And the person might also be taking some drugs like painkiller, and it's not really like particular about his or her diet. It's possible. When the person, like I told you, I said this person, the acid produced in the stomach is to protect the stomach and also to form digestive enzymes, to help the digestive enzymes bring it from inactive to active state. But if the person is not eating, and this acid continuous is being produced, it's produced continuously, whether you eat or you are not eating. So when the person is walking and is not eating, then the acid keeps eroding the mucosal membrane of the gastrum, and eventually the person will now have wounds there. Stress ulcer is common with those people that they don't eat. They don't eat, and they don't eat, but they can take drinks so that they can take them. Some people, they might not eat from morning till evening, but they can take at least 1 or 2 bottles of soda. That is even worse in the whole situation. Because by the time the acid gets to this soda, it's another reaction.
Okay.
And so, apart from that, there are also causes, the person has reduced immunity. So it's exposed to superimposed infection. When you are not eating, the way to build your immunity is your food. You are what you eat, you are not what you wear. So that's why it's important. Balanced diet is important in maintaining good immune system. Without that, the person can come down with ulcer. Some people can even come down with ulcer and they will be vomiting blood. At this level, people will not believe that it's ulcer. It's a perforated ulcer. And that time is complicated already. When they drink, I think some people, there was one case like that a man has not eaten since the morning and eventually came down with that type of issue. So ulcer can come up as a result of poor eating habits, but they can take soda, they can take drink, but they will not eat. Gastric acid keeps producing to digest food. When there is no food, the acid digests the gastrum, and this will cause wound. Start with pain, discomfort, poor appetite, then weakness, tiredness, fatigue, and the like.
All right. Is this condition infectious, and can it be managed or treated?
Yeah, thank you. Ulcer can be managed. It can be cured. Let me just use the language.
Is it also infectious?
Say?
Is it infectious?
No, and I will explain why it's not infectious.
All right.
Typical peptic ulcer that I just explained is caused by this H. pylori. H. pylori is a bacterium. It's a bacterium and is contacted through fecal-oral, poor hygiene levels. When people go to the restroom and they come back to eat without proper washing of hands, proper caring of the environment, they now eat, they now infect themselves with that H. pylori. That's how people get H. pylori. And that's why food handlers, one of their major tests done before approval in a normal setting is 2 tests to check whether they have H. pylori in their system. Now, if these people have H. pylori in the system and they were managing themselves very well by observing good hygiene levels, they will not transfer this to their buyer. But in case where we have a poor hygiene level with somebody that is infected with H. pylori and is not a food handler, is selling to everybody, it's easy for the person to transfer and to, infect a lot of people, but not directly. The way this person infects people is with his own poor hygiene level or her own poor hygiene level, poor water, poor food handling, and everything. That's why it's important. One major way of taking care of H. pylori is good hygiene level. Good water, good food. You don't just eat anyhow and then. And now it's very difficult to actually control H. pylori because everybody is now selling food as a means of living. So H. pylori or not, any ulcer can be managed and be cured. Every ulcer can be managed and cured perfectly. This is how it can be cured. First, you have to know where this ulcer is. Then the cause has been identified. Then if it's like H. pylori or if it's this gastric ulcer or leg ulcer, you can investigate and do this endoscopy. It will show you the ulcer, to show you that breakdown or saw of that mucosal membrane. And then you now come to take care of it, observe good hygiene levels, then you take medication. You can take medication. In case of peptic ulcer, we have this triple regimen that we can take care of it. You can take, we have this proton pump inhibitor, which is commonly used as omeprazole, zoprazole, and everything. Then you can also use this Gaviscon and everything, this mismatch they are using. It helps to line the acidic medium of the stomach, to help produce some, alkaline medium to stop the erosion. Then you add an antibiotic. Most likely we give this vancomycin or plus azithromycin, metronidazole or amoxicillin, whichever the case. If somebody is reacting to penicillinase family, you can give the metronidazole. So the triple regimen is this series: the omeprazole, the clindamycin, and this either metronidazole or the other one, which is amoxicillin. But in case this has to be taken religiously and it can last for about 14 days. The person can take the drug for 14 to about 3 weeks to clear and to make sure that it's okay.
All right.
But if you now go to quadriped phase, you go to the first management, which involves this one. That is the Gaviscon. Initially, the Gaviscon is not there in triple regimen, but when it resists, then you come back to the Gaviscon level. That is if you want to help to line the mucosa. So it can be treated, it's treatable, but you have to be intentional. And that is the way that gastric ulcer is. All other ulcer can also be managed, like skin ulcer. You take antibiotics, prevent infection.
That has been Dr. Winner Olatemi, general healthcare practitioner and mental health advocate on how to manage ulcer. We'll bring you the concluding part next week. Please plan to join us. Sound Health continues with trending health reports from around the world. Please stay tuned. You are what you eat and not what you wear. Eat balanced diet and boost your immunity. Avoid self-medication. Reach out to the nearest healthcare practitioner if you feel unwell. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #SoundHealth. The Sound Health is a sound mind. Make healthy living your choice.